right, welcome back, everyone. Hope you're having a great day so far. This is Recharging the Human Battery. I'm your host, Dr. Stefano Sinicropi. This is AM 950 radio, and this is a really important segment that we're going to do today. You know, we've covered so many different, health topics and talk about, alternative medicines and all kinds of things on this show. But today we really need to talk about a topic that is infuriating to both physicians, to other healthcare providers, to the public. And it's a huge issue, and that is the debacle of the insurance industry in the United States. You know, I talked about before about the tragic incident that happened. I'm not even going to name the guy's name because he doesn't deserve, to be named. But when the United Healthcare CEO was, tragically gunned down, if you remember, there was this very morbid and unusual tone of people basically condoning what this person had done. And obviously we, from an ethical standpoint, a moral standpoint, it's reprehensible. And it's something, I just won't talk about it because a lot of those guys do this, to live it forever in infamy. But that being said, I think that the take home from that whole entire series of events, which, as you remember, for like 2 weeks, 3 weeks, that's all people were talking about. It was on mainstream, it was everywhere, it was top of mind, at least for a little bit. The fact is that there was such a groundswell, so many people were so upset about all of the denials and the delays that they had personally in insurance, that if you read some of the comments in social media posts and even kind of mainstream media, they were horrific. I mean, they were just horrific comments, and they go both ways. Some were horrific because they obviously were supporting what happened, but they were also horrific in another way because there were reams and reams of comments from people talking about how a delay in care or denial of care dramatically hurt them in their own lives. Not to mention the fact that sometimes people had procedures, ended up with these massive bills. There were a lot of bankruptcies going on, personal bankruptcies, and there was all kinds of stuff. So the groundswell was absolutely insane. We're going to talk about, I really want to dive into the insurance debacle and just kind of bring in something that I recently, posted on social media, which absolutely went, berserk. And that is, I posted this Dr. Murphy, who is a U.S. congressman and also a physician. And he gave a fiery, excoriating, just ripping speech on health insurance executives. And I posted it and just kind of did some commentary on it. And the responses were insane. It was, again, that same, groundswell. Obviously, there was some inappropriate stuff in there. We just block it or just don't, basically ignore it. But there were a lot of people in there just talking about how much of a disgrace it is. There are people talking about in there about, how it impacted them personally. And there's a lot of doctors and other healthcare providers that basically said they quit and left medicine because of the debacle of the insurance industry. We have to do something about this mess. It has to be talked about. A lot of physicians are actually afraid to even speak up because they think that somehow the insurance companies are going to come after them or start following them or something like that. But if we don't speak up, this is going to just be devastating. It's already devastating healthcare as it is on both sides. It's devastating the doctor's ability to practice autonomously. And we'll talk about practicing without a medical license, AKA all the insurance companies. I don't remember those companies having a license. That's a whole other thing, but it's also affecting, patients. It's constant delay, deny, rinse and repeat over and over again. And it's making people not have life-saving medications, not get treatments that they need. People are destitute and out of work. It is absolutely ruining lives, not to mention a lot of people are going broke because they have these ridiculous medical bills that should be covered. So on the other side of the break, we're going to just dive into this. How did we get here? I want to talk about some of the comments that people put on this post, and then we'll kind of have a discussion about what are some of the potential, solutions going forward. I can tell you it's complicated. We'll see you on the other side of the break. We're on AM 950 radio. This is Recharging the Human Battery. 950. This is your favorite orthopedic spine surgeon / integrative health specialist guy here. Just going to rant. We're just really going to talk about what happened with the insurance, industry in our country. So first of all, I'm personally pissed off. I'm pissed off. I mean, it's ridiculous. I deal with it on a daily basis, day in and day out. I can tell you that we are asked as physicians to have a tremendous amount of responsibility over patients' lives, take care of them, do the right thing, make recommendations for them, and just basically pour our heart and soul into healing people and getting them better. And meanwhile, so much of our lives as physicians, and I want you to know this, I want you to get a peek behind the curtain, because I know you guys are frustrated that are listening to this, but I can tell you, I'm just as frustrated. I'm pissed off. It happens to my family members where there's delay, deny of care. It just sucks. Okay, right now. And it's not acceptable. And we need to do something, about it. And it is true. It's a rigged game. And guess what? You're losing. I'm losing. And when I say I mean the medical community. I mean, it's become an absolute joke. I actually, I did another post recently that people just went, crazy on. And that was that the peer-to-peer, review system is a scam, because it's a scam. It's nothing short of a scam. And so let me tell you about the peer-to-peer, review for those that don't understand. All right, you come see me for a consultation, and this can be either for something related to your spine, or it could be something, related to something else, right? And so I decide that I need to send you for a certain test, or we're going to do a certain operation based on all of the facts that we know, based on the fact that I've been in practice for 20 years, not 20 days, 20 years. And might know a little something about what the patient needs. Maybe a little more than the insurance company might know. But anyway, so you get denied for your care, and then you come back and you see you see me, and you're pissed off, right? You're like, I cannot believe it's been 7 weeks. I saw you. I still am not approved. So what do? We start making a big deal, and we say, hey, let's do a peer-to-peer insurance review. So first of all, it takes forever. Second of all, they call with these random numbers. It's always like they're like decoded, because they don't want you to be able to call them back. So they have to have all kinds of like screens in order to call them back. Most of the times, like, a number won't even show up on my phone. It just says unknown number. And I'm supposed to know this in the middle of my clinic when I'm supposed to do these peer-to-peer waste of time reviews. So anyway, I get on the phone with the peer-to-peer reviews. Half the time, if not more, the person is not even my specialty. That's one problem. Okay. Then when they are my specialty, I start talking to them about the case. Have they ever reviewed the images themselves? Negative. Never. Have they ever really dove into the case and thought about it? Have they reviewed the literature? No. The only thing they've reviewed is they consulted the insurance company handbook. The last time I remember, I did not know that the insurance company handbook was the ultimate guide to medical management of patients. So maybe I missed it. Maybe that was a part in my training that I kind of missed. I also missed the part where it was a three-way conversation as far as making decisions for the care of the patient. I don't remember it being the doctor, the patient, and the insurer. I just don't that's not quite exactly how I remember it. But again, it's been 20 years since I finished my training. Maybe I've forgotten. Maybe I don't know, or maybe things have changed. And I forgot to do the CME credits, to figure that out. Bottom line is the peer-to-peer reviews, and we've been talking about this ad nauseum amongst my colleagues. The chance of you reversing a denial when I do a peer-to-peer review for you is infinitesimally small. Now, sometimes they get reversed because we send in an exorbitant amount of documents, this and that. But I'm telling you, when they keep me on the phone talking to me about what's in the handbook and how it's not an approved service, and I tell them how wrong they are based on literature, based on your findings, based on all kinds of things, I can tell you, I might as well just do a monologue like on this radio show and talk to myself, because it's like talking to nobody. It's the most ridiculous thing. And I really should record these things and start just publicly just releasing them, because you'd be infuriated if you hear what actually goes on behind the scenes. And so the thing that we get from them, then I say, well, let me explain to you. Okay, here's what the patient has. They're disabled. They're out of work. what would you like them to do? Oh, I'm sorry, there's nothing we can do. It's not in the handbook. Feel free, to do another appeal. Or they say, things like, oh, that's noted, but oh, you thought there was an opportunity for you to actually reverse the, opinion here. No, no, no. This was just an informational call so that we can just let you know what is and what is not, in the handbook or the manual. Again, the thing that is now the standard of medicine is the insurance company manual, apparently. So again, it is a complete waste of time. Doctors spend so much time doing this. And I can tell you, it's one thing, in my world where we're trying to do it and get surgeries approved, the radiology. I mean, I sit there listening to my colleagues in the doctor's lounge trying to get life-saving medications approved. And they're there, like literally, some of them are like almost in tears trying to advocate for their patients, and they're just being completely shunned. Sometimes it takes days to get people life-saving when they're hospitalized. I'm not even talking about somebody that needs an elective procedure. Forget about that. I am talking about much more, serious situations. So when Dr. Murphy was just absolutely reaming the insurance companies, he needed a medication to live, and he says, I needed this medication to exist. It took him 8 denials. He is a U.S. congressman and a physician. 8 denials before he could fill his prescription at CVS. 8. And he said, imagine, he is a U.S. congressman and a physician, and look what happened to him. Imagine what is happening to the American public. Guys, this is catastrophic. And the thing about it is, the reason I want you to listen to this is because if it has not happened to you yet, it will certainly happen to you in the future. And unfortunately, sometimes we only focus on things that are happening to us or our families, and then we just don't understand. But I'm telling you, this is an issue that you need to really pay attention to, because when it happens to you, it can be devastating, and you need to know how to advocate for yourself. Remember what we always say on this show: you got to be the CEO of your own health. It's really important. And part of being the CEO is not just choosing the right doctors, but also understanding that you are in a very bad position when it comes to getting things approved by your insurance company. And the more you know up front, the more you can bring to the doctor's office, the more you come with the mentality that this is almost, it turns into like a legal fight to even get what you need done. You need to come with that mentality. You need to come very, very prepared, and you need to jump through whatever hoops you're asked to jump through, because that's another major barrier. They make you jump through hoops, half of which literally have zero effect on what your post-operative outcome is, or your procedure or whatever. It has zero meaning. It has no, and we all know it as physicians, but yet you still have to do it. You guys get pissed off at us, at the world. You don't want to do it, and then your care gets pushed out even further. So please don't cut off your nose to spite your face. I know this is frustrating. Clearly, I'm not happy, but it doesn't mean we don't continue to fight on an individual basis. I'm nowhere near thinking about, walking away just because the insurance company, sucks. But other doctors, and a lot of them are walking away, especially the ones that we need the most, the ones that have the most experience and the most knowledge and can teach, the youth and can do all that. I mean, these guys are walking away in droves. And you know what? The other half of them want to walk away like tomorrow, because it just has become so difficult to practice medicine. So I ask you, if you're providers on here, don't quit. Let's keep going. Let's keep doing the fight. All right, let's go to the chronology and where and how we got here. All right, I was born in 1973. Okay, so now you know how old I am. So I'm born in 1973. There's something called the HMO Act. It's called the Nixon Pivot. And basically, I'm just going to read this for you guys. All the incentives towards less medical care, because the less care we give them, the more money we make. This is what Nixon was told. Guess what his reply was? Fine. That's where we got it going. And, Nixon, I would say, listen, I stay out of politics, but I would say he's probably not the most beloved president ever in the history, of this country. We'll leave it that way. Next year, 1974, I'm 1 year old now. Okay. So we've come a long way from here, but it's something called the Iriza loophole. So this is the shield of impunity. This allows big corporations to bypass state consumer protection laws. So here's where the public already starting to get screwed. So if a state regulated plan denies you, you can sue. But if these plans deny you, your legal recourse is literally almost non-existent. And actually that it, comes to today. Yes, they don't like you to sue them, but are you going to get pretty far? No, unless it's some crazy egregious thing. All right, so now things are starting to change, but very, very slowly. So the 1990s, we start the rise of the gatekeeper. So we started shifting towards indemnity, where insurance pays the bill, to the managed care program. So insurance managers are managing the behavior of the doctor. So here's where, kind of the psychological warfare starts, trying to like shape the way that doctors practice. Again, this seeping in of people practicing medicine that haven't spent 20 years studying this stuff and really understanding. It's just all about profits over patients. And you're going to hear a lot of that. So let's then continue. So when we look at healthcare administrators, including insurance companies, let me give you a shocking statistic. And again, as we're going down into this, very, very dark world, since 1970, the number of doctors, since 1970, it's 2026. All right. The number of doctors since 1970, 150% growth. The number of administrators, okay, administrators are, like paper pushers, right? I mean, we need them to do stuff, but they don't have the responsibility of taking care of the patients. They've risen by 3,000%. That's 30 times, 3,000% rise. Okay. And this has happened not just in healthcare, but it's also happened, right? If you look at the higher education world, that's why when you send your kids to school, they slap you with a bill for 60 grand for 1 year. Too many administrators out there. That's a whole other, discussion. So there has been such a dramatic change since the 1970s. And unfortunately, these large companies have ballooned and become massive. People like United Healthcare and Blue Cross Blue Shield and Medica and Health Partners and all these things you guys are familiar with in Minnesota, they've ballooned and they have a lot of power. And with power comes immunity for us to do anything about it. And so they have tried to render most of us as physicians completely powerless. And forget about you, the consumer. Forget, they don't care. You're just a number. And again, I'm Mr. Positive, right? And we're going to go to bat for you. And believe me, we get the vast majority of people approved eventually. But having to jump through these exorbitant hoops is unbelievably awful. All right. So let's fast forward to today, right? I talked to you about the big conglomerates. Let's think about this. There has been a huge backlash. Of course, nothing's going to be done about it, but a huge backlash. Now we're in 2026. Insurance companies are now using AI algorithms that are basically designed. So let's talk about AI agents and algorithms for a second, because then I want to tell you how it works. Basically, the beauty about AI, and people don't realize it, is AI is not just like Google search engine where you go and say, oh, what restaurant should I be? What are the 5 top reasons for it? It's not, it's more than that. AI, you can develop programs that basically what you do is you tell the AI what your objective is. And the truth is, AIs are so advanced now that if you know what your destination is, what the rate of getting there, and all these other things, if you put those parameters in, AI can do almost anything, especially when it's going against non-AI, more antiquated tools. So back to the insurance companies. If you look at these insurance companies that are under fire, with United Healthcare leading the pack, of course. They are using algorithms that have major error rates, and that was the thing, and that allows them to deny the claims in bulk. But I will tell you, if you plug into the algorithm the objectives, right? It's just like the 3 laws, right, of robotics, right? You're plugging in objectives. And if your objective is make sure you deny as many patients as possible and make sure you delay as much care as possible, and you put in the certain parameters, and then you're going against antiquated hospital systems or private practice systems or whatnot, obviously it's going to lead to a massive amount of denials. And I can tell you, we are pushing upwards of 40% with some insurance companies of denials. Think about that for a second. Are you telling me that 40% of what doctors are recommending is not appropriate? Okay, if that's the case, we should all stop practicing medicine and do something else. Imagine 40%. So 40% of the people that are asking for tests and stuff, they're wrong because of some manual. Give me a break. Okay, give me a break. It is a joke. So that again, that doctor-patient relationship is absolutely broken. And so let's think about it. If you delay a surgery for months and months and months, they're keeping that money in some, like slush fund account that then is gaining interest and stuff like that. So the more they delay care, the more it's profit. But even on top of that, it's even worse than that. So we talk about, I'm telling you, you gotta, like, I would encourage you, we should write a book about this, about, kind of doctor, a lounge talk. And we talk about this, like constantly. We all are aware that ultimately the goal in doing all this delay and denying where people have to do, appeals and appeals and appeals while they're home suffering and in pain and on narcotics and all this other stuff is that a significant portion of them are going to drop out of the system because they're going to give up. They're either going to get addicted to a bunch of medications they shouldn't be on and then just become chronically ill with something else. And then they just kind of don't do anything because they're out of the workforce. They're done. Right. Or they're going to say, you know what? I've delayed too long. I'm in pain. I'm just going to live this way, or whatever happens, or even worse, they get delayed or denied and then they don't make it, which is not good. And again, what's the recourse on that? There's not much. There's not much, case precedents to have recourse on insurance companies, delaying care. Bottom line is we all know that these tactics are all for people to get discouraged, for the doctors to get discouraged, right? I told you about the peer-to-peer scam. And right after a while, doctors are like, I'm not doing it anymore. So if you think about it, if you're a busy doctor and you have all these patients being denied and delayed, if you have enough patients, you're just like, well, that's too bad. Some people get denied, some people don't. I'm just going to get. We should never take that tack. We should try to fight for every single person, but it's human nature. Doctors are overworked. They're overburdened. They're suffering from burnout. Suicide rates are very high. I can go on. Same thing for like nursing and all these other people. People are not in a good place. And then you pile on that they have to deal with these insurers all day. Of course, people just give up. They're like, screw it. I can't do this anymore. They either walk away, they stop paying attention, they stop responding to correspondence, they just cut off peer-to-peer, calls. I don't cut off the peer-to-peer calls because I just like yelling at the peer-to-peer guy and just asking them, this is what you went into medicine for? To be a gatekeeper for the insurance company? Really? This is the pinnacle of your life? Is being the insurance company doctor? Come on, man. Seriously. I mean, we got to really think about like where we're going and what we're doing. And I'm sorry to be frustrated. And I know you might need a paycheck, but wrong place. Sorry. All right, let's move on. So what are the people saying out there? So I'm going to go here. Let me pull up my post and I'll just tell you some of the very interesting commentary that I got when we, put out there, things on the insurance companies and what they're doing, and Dr. Murphy's, excoriating response. We'll just go through this just really quick, and I'm not even going to go in. I'm just going to go in order. It's disgusting. We pay premiums. Why do they deny care? Right. So as I'm scrolling along, a lot of them are shorter. Here's a doctor. Amen. I don't like being a doctor anymore. Is that what you want your doctors to, if you want this to start spreading, that doctors don't even want to be in practice anymore? All right, here we go. Right now, here's a patient. Right now, I'm going through the ridiculous prior authorization process, denials for medications I need. I am a veteran and can't for the life of me understand why, how, but the greed and evil that is perpetuated is insane on a level that I can't even understand. Wow. And then he goes, and then it's like a complete tirade after that. So I'll spare you because that's like a complete, that's a novel. And then there's discouraging stuff, and nothing will change. There will always be someone in authority to take kickbacks, padding their pockets, and putting people's lives in danger. We need change now, and yet nothing will get done. My God, this is true. What are we going to do? Somebody was very astutely, it took years to do it, but the final straw was 1973 when the HMO Act was passed, and dear old Nixon signed it. So that was interesting. Here's another one. This is a complaint on us, the doctors. And again, I tell you, people are burnt out. It's amazing nowadays. You walk into a doctor's office, they don't even look at you anymore. They put their face in their laptops. They ask you questions without looking at you. They never touch you. They never ask you how you're doing. And you're just a piece of paper. You get your labs drawn, and then in some way they move on with the care. So again, this is a very long one. I don't want to go through the whole thing because we'll be here all day, but I can tell you there's tons of comments like that. People are getting discouraged and frustrated. Just imagine your doctors being so frustrated by so many things going on in medicine, right? Their lack of autonomy, they're being overworked, they're being stressed to the max, them having a lot of mental health issues because of all the stuff that's going on. And again, I'm not asking for your sympathy. I mean, as doctors, I know we're not going to get a lot of your sympathy, and that's fine. But I could tell you, there's a lot of problems going on. And what we don't want to do is have these doctors in a place where they're so discouraged that they don't want to, do it anymore. Here's another one. I wasn't on insurance company rolls for the last 20 years of my practice as a family practice physician in Texas. I was then able to focus on patient care, and I had the time to do a good job without burning out. Amen to this doctor. Now, it's very difficult to do that in a lot of markets coming out completely of the insurance system. I will tell you, it just takes a lot of moxie, for people to pull out and do that. But the ones that do it and are able to build successful practices, yeah, it's out of pocket. But guess what? They spend a lot of time with the patients. They can really do what they were called to do when they decided to become physicians, and that is give everything they have to each and every patient. It is becoming almost impossible to do that the way the current medical system is set up for these doctors. And so I think it's easier for the proceduralists because, right, if you're seeing a doctor and you need a colonoscopy or you need an endoscopy or some type of surgery or something like that, it's easier for those doctors to get through it in a short period of time. If you just go in, I don't feel good, or you've got some significant chronic disease, or you have multiple chronic diseases like most of you that are listening to this right now, you need somebody that can actually take their time and just really understand what the options are, explain them clearly to you, have you be a partner in your own health so you could be a CEO in your own health, etc. That's almost impossible in the way the system is structured right now. And a lot of it goes back to the decay that's happened in the insurance world, the decay that's happened in the sovereignty of the, physicians and providers. And it's a huge problem. Let's continue on here. Thank you. I have screamed this for a very long time. Greed has taken over the insurance industry. My response, we all need to scream louder. That's what I had for that person. So again, and interestingly, the next response, louder, louder, louder. Let's keep shouting this from the rooftops until they get it through their thick skulls. Well, I can tell you, here's a congressman. He's basically destroying these insurance industry executives. But yet, what's Congress doing? At the last I checked, they're not doing anything to help the American public. And I'm an equal opportunity hater when it comes to this because both parties are complicit in the disaster that is called the American insurance industry today. And I know I'm not going to read any of the partisan stuff. People like to get partisan on these things. Really study this stuff and you'll understand a lot of the stuff that's out there and what is being propagated is definitely not in your best interest. Here's another one. Dismantle the entire system and move towards a European style system where everyone has access, paid in part for a small monthly payments from every working person in the country. No more health insurance and no more being bankrupted because you're ill. Now, I will tell you, there are many healthcare systems, and I've studied European healthcare systems, the Canadian healthcare system, and others. I can tell you there's pros and cons of every healthcare system. Should there be a safety net for every single American? So if you get a serious injury or a serious disease, should that absolutely 100% be covered? Yes, we have to cover our citizens. That cannot be left to private corporations and things like that. But When it comes to having elective things, my fear, and again, leave the comments, below, if you're, seeing this on YouTube or wherever, my fear is that if you look, for example, at the Canadian health system, yes, you can get access to care, but having a lot of family members in the Canadian health system, I'll tell you, here's the difference. If you fall and break your femur, you're good. They bring you in, they take care of you. If you get a cancer that can kill you, yeah, absolutely. They're going to operate on you right away, just as they do in the States. If you need something elective, like my cousin did in Toronto, who required a bilateral hip replacement because she has ulcerative colitis and her hip joints were completely destroyed, was using a walker to get around in her 40s. This is a problem. It was a 2+ year wait to get those done. Now, they did not have the means to go to the States to do that. And so she waited. She got her hip replacement. She did fine. Most of the family members, though, go to the States whenever they need something done, because if you decide your knee is killing you and you want to have that fixed and there's not other options for you and you can hardly walk or function, you want to get that done in a more timely fashion. So again, even though I'm jumping up and down complaining about our system because it's changed so much, it's still, if you need, for example, a knee replacement, after you jump through a series of hoops, and it might be months and months and months, most people can still get that operation done. But if you're in Canada, you can't get that operation done for a much longer period of time. I'll give you another example for the Canadian healthcare system. And again, I think there's parts of everything. I think that's why cooler heads need to sit down. We got to figure this stuff out. I'll tell you another thing. I had another cousin in Canada who ended up having their surgery here in the States as well. So she had horrible stenosis in her cervical spine. And I could tell you that she needed surgery. She was in disabling pain. So yeah, she hits me up. I don't know this person well, more of a distant cousin, hits me up. It's like, I got to do this. So we start communicating. Finally, I said, no problem. I'm going to reach out to a very well-known institution there in Toronto. I'm not going to name names because I don't feel like, people getting upset. I think I've upset enough people already on the show. But anyway, call this institution, left messages for the department heads and said, hey, listen, I'm an orthopedic spine surgeon here in the States. My cousin has this. Here's her diagnosis. This is what she needs. She's already been evaluated. We just want to move her up because waiting for 1.5 to 2 years when somebody has crippling pain down their arm isn't going to cut it. Let me tell you something. I had myself, my team call, everybody called, 0 return calls. I'm a spine surgeon. Do you know why? Because in those quota systems for elective surgery, why would they care? So there's no incentive for people to care as much. So we got to be really, really careful for, what system that, we're going on. So, okay. So last comment, and then we'll kind of get back to business here. I have worked for a psychiatrist for 47 years. What I go through with CVS, Walgreens is a way to delay patients getting their medicines. They tell my boss what meds he can try before they will consider approving the med that the patient actually needs. And these disgusting people have no idea about my patients, but tell a board certified doctor how to treat. Amen. That pretty much sums up the whole game. These guys are telling us what medications to put people on, what and when to do surgery, what care they need to get before they get anything else. They decide all these things. And I can tell you, back to the peer-to-peer process, lately, it's gotten so bad that now they're just making stuff up. They literally make up things like rules, okay? I can't get into it. It's more complicated, but they make up rules that are not even based on anything. It literally pulled it out of thin air. It's like a bunch of guys sitting in a room being like, somebody just says, hey, maybe we could do this as a denial reason. And everyone's like, that's brilliant. Let's do that. That sounds great. More denials. Let's go. And that's how bad it is. And I could tell you the last peer-to-peer that I did, this was just last week, basically they made up a reason to deny my patient for care. And I told them that the only recourse that the patient should have is suing the company. But I also told them that this insurance, group, okay, they're a smaller subgroup of a different insurance company. There's all these subgroups. We can get into that another time. But they had made that then their policy to deny all people care, just like my patient had. what my patient has is one of the most studied problems in spine surgery that has so many papers supporting that operation for what she has. It's insane. But yet they took it out. They said, oh, no, it has to be way worse than that, based on no data, completely made up. Again, it's that person in the room. And then that the boss is like, that's amazing. Thank you. You get a promotion because you just saved our company, hundreds of thousands, if not millions of dollars with your suggestion. So this is where we are. All right. So let's talk about what needs to happen on a broad, basis, right? So we have insurance companies whose revenue is ridiculous. United Healthcare pretty soon is going to be in the revenue range of $500 billion a year. Right now, they're like at $370 billion. That's bigger than a lot of small nations. This is insane. This is literally insane, right? The gaslighting is going on constantly. They're just practicing medicine without a license, without ever touching the patient. It's a complete joke. So what do we need to do about it? Number one, we cannot quit in this fight. We just can't. We just cannot quit in this fight. That means you, and that means me. And so for the doctors out there, for the providers out there, I know you're frustrated. I know you're miserable, but we have to keep going to bat. When we quiet down, they become even more emboldened and put in even more rules to block us from practicing medicine the way it should be practiced, and to block the patients from what they're getting. So we have to stay in the fight. And if you are a person, I know that it feels like you're just not doing anything, but I'm telling you, when these Congress people get bombarded with enough pushback, enough letters, enough petitions, but more importantly, throw these people out of office if they're not helped. This is one of the most important. And again, right now, I know there's a lot of political stuff going on. I know there's a lot of stuff. I am telling you, so much of it is smoke and mirrors, because when you have a serious medical problem and you can't get care, believe me, you do not care what the latest nonsense that's going on, that everyone's fixated on, and social media is all in a buzz. That is potentially life and death for you. So we have to focus on these issues. So I need you guys to rise up again, like write those letters, go to meetings, go to these town halls, just rip the Congress people and just tell them you have to do something about it, or you will not be sitting in your seat anymore. And you just have to have a different idea. We need to start picking people, not necessarily based on what letter they have after, but what are they actually going to do? Because I'm sick of the BS, because nothing is getting done. We need people that are doers, not talkers. And I've seen a lot of talking. I've gone to DC twice to lobby. I've met with both sides of the aisle. There's a lot of talking, and I don't see a lot of doing. So we have to continue to fight. If we're complacent, if we're, upset about it, if we just, all we do is complain to our neighbors and our family and amongst each other, nothing is going to happen. So we absolutely need to do that. And so, listen, there's a lot of different ways to look at stuff. So when the prior authorization, so let's think about a few solutions, okay? And I'm not saying I have all the answers, because it's just brutal, but we need solutions to this pre-approval process. So number one, when you have doctors that are ethical, they're doing good work, they've been in practice for a long time, or their practice been practice for, it's very easy to look at what they're doing. If they eventually get most of their patients approved like we do, why are you denying that? So we should have gold card access. So in other words, it should go back to, we make a decision and it happens. There should only be a 48-hour window before people get approved or denied, because you don't need 7 days, 14 days, 21 days to figure out if the service is necessary. You need the doctor's note, and to make sure everything on there is above board. If it is, it should go forward. Next thing is, what about a legal challenge to the charter of these insurance companies? Right? Their primary duty needs to be to the patient's health, not to the shareholders' dividend, not to the delay, deny, rinse, and repeat is what's happening. And then finally, and yes, I'm going to say this, we need to just create a new system that bypasses all this. I know that it's painful sometimes having to pay out of pocket. I know people can't afford it. So make sure you're putting money in your HSA accounts. Make sure you're saving for yourself and for your health, because sometimes you have to go to direct primary care models. Sometimes you have to go to integrative clinics that may not take your insurance, because they're done doing that, because they actually want to treat you the way you need to be treated. And so on the other side of the break, we'll wrap this up. I wish this, this whole section was another hour because there's so much more to talk about. But let's wrap it up. Hopefully this spurs some discussion amongst you guys. But please, if you hear this, don't give up. Fight harder. Please follow me on social. It's Dr. Stefano MD. Follow me on it. Please respond to some of these, posts that I'm doing. I want to hear what your take is. We're on AM 950. This is Recharging the Human Battery. We'll see you in a minute. All right, we're back on Recharging the Human Battery Radio. We're on AM 950. I'm Dr. Sinicropi. I'm fired up. I'm actually pissed off today because the more I talk about insurance companies, the more those chemical, we always talk about chemicals of love. I'm not getting the chemicals of love right now. I'm getting the fight or flight response, except I'm feeling more like I'm, like the lion going after these guys as opposed to the other way around. I mean, these guys are trying to absolutely take all the power away from the physicians, other providers, and patients. It is an absolute travesty. I can tell you that the number one thing that will get that doctor's lounge fired up, if I walk in there, I'm just telling you, I'm going to do this actually. I'm going to record it because I want you guys to see. If I walk in there and I tell all the doctors, hey, you guys just give me 5 minutes. Let's just sit around. If I just like mic people up and I just say, hey, let's talk about how much insurance companies suck. This will turn from 5 minutes into people will be late for their cases. They just will stop doing whatever and they will just go crazy, way worse than what I'm doing right now because I'm trying to be judicious with my words. I'm trying to keep this as PG as humanly possible. But I can tell you that doctor's lounge talk on what insurance companies are doing to the patients. And then forget about it. If we went around the room and said, hey, tell me your most heartbreaking insurance denial and how that led to actual harm on the patient. There is not a doctor that does not have stories about how denials or delays have led to harm. This isn't like, oh my God, I ordered something from Amazon and it came, 2 weeks late. We're all pissed. Oh my God. No, this is people's lives. This is people's health. This is limbs. This is life itself. I mean, are you kidding me? This is how we're playing. How did this turn into a game? Why is your health and your life? Why is it a game? It's not a game. I've seen all the time. I've seen people get absolutely screwed, going denial to denial, doctor to doctor until they finally got care. And again, I'm not saying that the only problem is, insurance companies. There's also complacency in medicine. There's also siloed, behaviors in how we approach things and just being too fixated on Western medicine. You've heard me rant about those things. But today, I want to just keep my crosshairs directly on these insurance companies that are absolutely destroying the landscape. Think about it. Do you want to be involved in a system where people are so disgruntled? They're the people that are seeing you that are making medical decisions for you. If they're already disgruntled or they already pre-know that you're going to get denied for your care and it's going to be very onerous, and then they start becoming complacent or giving up, this is what the system wants. And this is what we need to fight back against. All of us, those in healthcare, we need to remember why we went into this in the first place. For you doctors out there, you got to remember that white coat ceremony that you had way back when. I remember at Columbia University when I put that white coat on. I mean, right now I'm getting goosebumps just thinking about putting my white coat on. Do no harm. We are healers. We are here to heal. Think about that and think about how it is also our responsibility now to rise up and fight this battle. And if that means going to DC, if that means lobbying at your local capitals, if that means just going to bat every single day for your patients, despite how annoying it is, how painful it is, how irritating those peer-to-peer reviews are, we have to keep doing it. We have to keep fighting because our patients absolutely rely on it. Because if we don't do it, it's over. It is absolutely game over. And for you, the public, what I want you to take from this radio show, and I hope that this has at least stimulated something in you, I want you to take from this, it is much worse. For those of you that haven't experienced it to the level I'm talking about, it is much worse. This is not hyperbole, way worse than you think. Much, much worse. I'm an insider. I see what happens. Nothing is for your best interest, and it's time to make a change and fight back. So we'll continue this on another episode. This has been great. I'm going to go and get my blood pressure down by doing some meditation and getting in the red light bed. But on that note, we'll see you next time on Recharging the Human Battery Radio. We're on AM 950. This is Dr. Sinicropi. Go be CEOs of your own health. Fight back against the behemoth that is the insurance company. Let's take back our health.